please stop what you are doing right now. What I'm about to share with you in the next few minutes could genuinely save your life, or the life of someone sitting right beside you. There is a virus spreading right now across the United States and parts of the world. Most doctors are not discussing it in their waiting rooms. Most news channels are barely covering it, and it is quietly sending people, particularly adults over 60, into intensive care units with almost no warning at all. It is called hantavirus. My name is Dr. Benita Fieldhouse. I am a medical doctor and health educator. And today, I am going to tell you exactly what this virus is, precisely how it enters your body, what it does once it is inside you, and most critically, what every single adult over 60 must do this week to protect themselves and the people they love. According to data published by the Centers for Disease Control and Prevention, the case fatality rate of the most dangerous form of hantavirus, a condition called Hantavirus Pulmonary Syndrome, sits between 38 and 50%. That means nearly 1 in 2 people who develop the severe lung form of this disease do not survive it. And here is the part that is not being said loudly enough. Adults over the age of 60, whose immune systems have naturally declined by up to 60% compared to a 30-year-old, are among the most vulnerable people on Earth to this virus right now. Before we go any further, I want to ask you something personal. Tell me in the comments section right now, how old are you? And have you recently spent time near a cabin, a storage shed, a barn, a garden outbuilding, or any enclosed space that might have housed mice or rodents? You may be surprised by what you realize when you truly think about it. Drop your age and your honest answer below. I will read every single one. Now I am going to walk you through everything you need to understand about hantavirus. What it is, how it spreads, what it does to the human body step by step, real documented cases of people who have been infected, and 5 critical protective actions ranked from important all the way up to the single most powerful thing you can do right now. We are counting down from 5 to 1, and I need you to stay with me until the very end, because number 1 is the action almost no senior is currently taking. And when I tell you why, it is going to stay with you. Let us begin at the very beginning. What exactly is hantavirus? Imagine your body as a city. Your immune system is the police force protecting every street corner and every entry point. Now imagine a threat so small and so precise that it slips through the ventilation system, bypasses every checkpoint, and goes directly for the power station. In this case, your cardiovascular system and your respiratory system, your lungs and your heart simultaneously. That threat is hantavirus. It is a single-stranded RNA virus, which simply means it carries its genetic instructions in a compact ribbon of biological material that it uses to take over your own cells and force them to produce copies of itself. It belongs to a family of viruses called Bunyaviridae. It has existed on this planet for thousands of years, living quietly and harmlessly inside rodent populations. The deer mouse is the primary carrier in North America. The rodent itself almost never gets sick. It simply carries the virus in its saliva, its urine, and its droppings, shedding it into the surrounding environment constantly and silently, with no visible warning signs of any kind. There are multiple strains of hantavirus found around the world. In North America, the primary strain responsible for severe illness is called sin nombre virus, which translates from Spanish as the virus with no name. It was first identified in 1993 during an outbreak in the Four Corners region of the American Southwest, where a cluster of young and previously healthy Navajo individuals died of a mysterious respiratory illness that completely baffled the physicians treating them. In South America, a strain called Andes virus has caused outbreaks in Argentina, Chile, and Brazil. It carries the terrifying distinction as being the only known hantavirus strain capable of spreading directly from person to person. In Asia and Europe, different strains cause a condition called hemorrhagic fever with renal syndrome, which attacks the kidneys rather than the lungs. All of these strains share one critical characteristic. They exploit precisely the kind of immune vulnerabilities that naturally accumulate inside the aging body. Now let us talk about how this virus actually spreads, because this is where you need to pay the closest possible attention. The primary route of infection is inhalation. You breathe it in. When infected rodents urinate, defecate, or shed saliva in an enclosed space, a garage, an attic, a basement, a cabin that has been sealed through winter, a garden shed, even the interior of a vehicle that is set unused for months, the virus particles attach themselves to tiny dust particles and become aerosolized. That simply means they float in the air as an invisible cloud. When you walk into that space, when you sweep up droppings without protection, when you move boxes that have been sitting undisturbed, you inhale those invisible particles. They travel down your airway, they reach your lungs, and the infection begins. Research published in the journal Emerging Infectious Diseases found that the virus can remain viable and infectious in the environment for several days, and in cool, dry, sheltered conditions, potentially significantly longer. Secondary routes of infection include direct contact, touching rodent droppings or nesting materials, and then touching your face, eyes, or mouth. There is also evidence of transmission through rodent bites, though this is considerably less common. And as I mentioned, the Andes virus strain in South America has produced documented cases of human-to-human transmission through close contact with an infected individual, which is why researchers worldwide are monitoring it with serious concern. Here is something critically important that I need every adult over 60 to hear and remember. After the age of 65, your mucociliary clearance declines in efficiency by approximately 30 to 40%. Your mucociliary clearance is the system of tiny hair-like structures lining your airways that trap and sweep out foreign particles before they can reach your lungs. It is your body's first physical defense against anything you breathe in. According to research from Johns Hopkins University School of Medicine, this means that the very first defensive barrier your body has against inhaled pathogens like hantavirus is significantly weaker in your body right now than it was 30 years ago. What a 35-year-old might partially clear before it reaches the deepest lung tissue, a 68-year-old is far more likely to have carried all the way down to the alveoli. The alveoli are the tiny air sacs deep inside your lungs, where oxygen exchange happens, and where hantavirus causes its most devastating and irreversible damage. So what actually happens when hantavirus enters the body? I want to walk you through the timeline carefully because understanding how this disease progresses is absolutely essential. The incubation period, which is the time between exposure and the appearance of the first symptoms, ranges from 1 to 8 weeks, with most people developing symptoms between 2 and 4 weeks after exposure. This long, silent window is one of the most dangerous features of this virus. You can feel completely well and have no idea that a catastrophic storm is already building inside you. The illness begins in what physicians call the prodromal phase. Think of this phase like the sky darkening in the hours before a severe storm. For the first 3 to 5 days, the infected person experiences symptoms that feel almost identical to influenza. Fever, fatigue, muscle aches, particularly in the large muscles of the thighs, hips, and lower back, headache, dizziness, and sometimes chills. Some patients also report nausea and vomiting. At this stage, the vast majority of people, including many physicians who are not specifically looking for it, would not suspect hantavirus. They would assume influenza, COVID-19, or a common viral illness. But while the patient feels mildly unwell, the virus is quietly replicating inside the cells lining their blood vessels. These cells are called endothelial cells. As the virus multiplies, it causes those cells to become leaky, and this is the point where everything changes with terrifying speed. Within 4 to 10 days of those initial flu-like symptoms, the disease enters what is called the cardiopulmonary phase. This is the phase that sends people to the emergency room. As the blood vessels inside the lungs become increasingly leaky, fluid begins flooding the air sacs. The lungs, which should be light and airy and open, begin filling with fluid. The patient develops rapidly worsening shortness of breath, not a mild breathlessness, a terrifying, gasping inability to draw air. Oxygen levels in the blood plummet. Blood pressure drops. The heart, struggling to pump effectively without adequate oxygen, begins to fail. Hantavirus Pulmonary Syndrome can progress from the very first sign of respiratory distress to complete respiratory failure in as little as 24 to 48 hours. Many patients require mechanical ventilation and intensive care unit admission within a single day of their breathing becoming compromised. This is why recognizing this disease rapidly is so critical. And this is exactly why I am talking to you today, before you or someone you love finds themselves in that situation without warning. Patients who survive the cardiopulmonary phase and with intensive supportive care in a modern ICU, many do, enter what is called a diuretic phase, during which the excess fluid in the lungs begins to be expelled through the kidneys. Recovery can take weeks to months. Some survivors report persistent fatigue and significantly reduced lung capacity for years afterward. There is currently no specific antiviral medication approved to treat hantavirus infection. Treatment is entirely supportive. Oxygen, mechanical ventilation, careful fluid management, and time. This is not a disease where a doctor hands you a prescription and sends you home to recover. Prevention is not merely advisable. Prevention is everything. Let me now tell you about real people this has happened to, because I need you to understand with complete clarity that this is not a theoretical risk. In May of 2012, a man in his late 30s, let us call him Robert, reflecting the documented demographic of the case, stayed in one of the tent cabins at Curry Village in Yosemite National Park in California. He returned home and within 3 weeks developed rapidly progressive respiratory failure. He was one of 10 confirmed cases of hantavirus infection linked to that Yosemite outbreak that year. 3 of those 10 individuals died. The CDC investigation found evidence of rodent infestation inside the insulation of the cabin walls. Thousands of previous visitors to those cabins had to be notified and monitored. The outbreak forced a complete redesign of the structure. In 2020, a case was reported from Washington State involving a man in his early 60s, let us call him Gerald, who spent a weekend clearing out a long-unused storage barn on his rural property. He was a retired farmer in generally good health who wore no respiratory protection during the work because he had done similar tasks many times before without any ill effects. Within 2 weeks, he developed what he believed was a severe cold that progressed into pneumonia. He was hospitalized and placed on a mechanical ventilator within 48 hours of admission. He survived after 18 days in the intensive care unit, but spent the following 8 months in pulmonary rehabilitation. He has reported that his breathing capacity never fully returned to what it was before that single weekend of work. In Chile and Argentina, the Andes virus strain produced multiple documented clusters of person-to-person transmission, including a 2019 outbreak in the Chubut province of Argentina that resulted in 29 confirmed cases and 11 deaths. Health authorities identified transmission chains moving through households, and in one documented instance, to a healthcare worker who had cared for an infected patient. The World Health Organization issued formal guidance in response to that outbreak. In Colorado, Utah, and New Mexico, states within the historical endemic zone of sin nombre virus, public health departments report sporadic cases regularly, particularly in spring and summer, when rodent populations peak and people spend more time in outdoor structures. In 2023, the Colorado Department of Public Health confirmed 3 cases of Hantavirus Pulmonary Syndrome. 2 of those 3 cases involved adults over the age of 65, one of those individuals did not survive. The 5 things every adult over 60 must do this week, ranked from important to the single most critical action you can take right now. Starting at number 5. This week, conduct a complete and thorough rodent audit of every enclosed space on your property. Your garage, your basement, your attic, your garden shed, any outbuildings, your crawl space, any vehicles that sit unused for extended periods. You're looking for 5 specific signs of rodent activity. Droppings, which appear as small dark grains of rice. Gnaw marks on wood, plastic, or food packaging. Nesting materials made from shredded paper, fabric, or insulation. Grease marks along the base of walls where rodents travel repeatedly, and a distinctive musty odor that an active infestation produces. Do not conduct this inspection by leaning into enclosed spaces without protection. Open doors and windows and allow the space to air out for at least 30 minutes before you enter. If you find evidence of rodents, do not sweep, do not vacuum, and do not disturb the area with a broom. I will explain precisely what to do instead when we reach number 3. The reason this audit is so urgent is this. Research from the University of New Mexico's Department of Biology found that nearly 12% of deer mice trapped in rural areas of the American Southwest carry sin nombre virus. 12%. That means roughly 1 in 8 mice in those regions is a living biological hazard. And for your body specifically after 70, your innate immune response, the rapid-fire first responder system that attacks pathogens before your adaptive immune system even mobilizes, operates at roughly 40% of the efficiency it had when you were 40 years old. You simply do not carry the biological margin for error that a younger person has. Do this audit in pairs. Bring someone with you so that you have assistance, and so that someone always knows where you are and can help you out of an enclosed space quickly if you experience any respiratory discomfort. Now, number 4. And this is where almost everyone makes a dangerous mistake. Proper personal protective equipment. And I need to be very specific because the type of protection is everything. When you enter any space with evidence of rodent activity, you must wear an N95 respirator mask, not a surgical mask, not a cloth face covering, a certified N95 respirator that creates a complete seal around your nose and mouth and filters out at least 95% of airborne particles. A standard surgical mask allows air to flow around its edges and provides essentially no meaningful protection against aerosolized hantavirus particles, which are small enough to pass through those gaps with every breath you take. You also need disposable nitrile gloves to protect your hands from any direct contact with droppings or nesting material. If the infestation is significant, a disposable Tyvek suit or old clothing that can be immediately bagged and washed in very hot water is advisable. I understand this may feel excessive for a trip to the garage, but consider this. The protective equipment costs approximately $15 to $20 at any hardware store. The average intensive care unit stay costs between $3,000 and $10,000 per day, and no amount of money purchases back the lung function lost to Hantavirus Pulmonary Syndrome. After the age of 75, your body loses approximately 35% of its pulmonary reserve. Pulmonary reserve is the extra breathing capacity that activates when your lungs are under stress. You have considerably less margin than you may realize. Before entering any potentially contaminated space, open all available windows and doors and allow fresh air to circulate for at least 30 minutes. This dramatically reduces the concentration of aerosolized viral particles in the air before you step inside. The ventilation and the protective equipment work together as a combined shield. Now, number 3, and this is the one I see people get catastrophically wrong almost every single time. If you have found evidence of rodent activity and you are ready to clean the area, the most important thing you must know before you take a single step is this. Never dry sweep. Never use a dry vacuum. Never use a leaf blower to clear rodent droppings. These actions aerosolize the virus particles and create a cloud of infectious material that you then breathe directly into your lungs. This is how healthy people end up in the ICU. Instead, the CDC recommends a specific and proven protocol. Thoroughly wet the contaminated area with a disinfectant solution, either a commercial disinfectant or a mixture of 1.5 cups of household bleach per 1 gallon of water, and allow it to soak for a minimum of 5 minutes. Then, while wearing your N95 respirator and nitrile gloves, use paper towels or disposable cloths to carefully collect the dampened material and place it immediately into a sealed plastic bag. That bag then goes inside a second sealed bag and is disposed of in a covered outdoor rubbish container. All surfaces where rodents have traveled should be wiped down with the same bleach solution. Mop hard floors with the solution. Steam clean carpets where possible. This wet cleaning method prevents virus particles from becoming airborne and reduces your exposure risk by an estimated 90% compared to dry sweeping, according to guidelines published by the New Mexico Department of Health. For your aging immune system, this is not optional technique. This is the difference between a manageable exposure risk and a potentially fatal one. If this information is genuinely valuable to you, and I believe it is, please take 5 seconds right now to click the like button below this video and subscribe to this channel if you have not already done so. I release information every single week that is specifically researched and designed for adults over 60. The platform only shares these videos with more people who need them when you engage with them. Please like, subscribe, and share this with one person today. It costs you nothing, and it may save someone's life. Now, number 2, and this one is about speed. Because with hantavirus, the window between the start of symptoms and the point where the outcome becomes determined is not measured in days, it is measured in hours. Here is the specific pattern of symptoms that should send you to a hospital emergency department immediately, not an urgent care clinic, not a call to your GP 2 days later. A hospital emergency room today. The combination of fever above 101 degrees Fahrenheit, together with muscle aches in the large muscle groups of the thighs and lower back, combined with progressive shortness of breath that is worsening over hours, even if that breathlessness feels relatively mild at first, in any person who has had potential rodent exposure within the past 1 to 8 weeks, is a medical emergency. When you arrive, tell the emergency room physician specifically and clearly, "I may have been exposed to hantavirus. I was near rodents. Please test me for hantavirus." Do not assume the physician will make this connection independently. In a busy emergency department, hantavirus is not the first condition on anyone's differential diagnosis list, which simply means the mental checklist of likely conditions a doctor considers. You are your own most important advocate in that room. Research published in the Annals of Internal Medicine found that patients who communicated a potential hantavirus exposure history to their treating physician within the first 24 hours of respiratory symptoms had dramatically better outcomes than those whose exposure history was identified later. Early recognition means earlier access to ECMO, which stands for extracorporeal membrane oxygenation, essentially an artificial lung machine that supports breathing while the body fights the infection, and earlier access to the intensive supportive care that gives survivors their best possible chance. After the age of 65, your inflammatory response becomes paradoxically both weaker and more unpredictable. Researchers at Stanford University's School of Medicine call this phenomenon inflammaging. It means your body may not signal the early warning signs of serious illness as clearly or as strongly as a younger person's body would. You may feel less sick than you actually are. Take symptoms seriously. Act immediately. Do not wait to see if it resolves on its own. And now, number 1, the single most powerful protective action every adult over 60 must take this week. Have a direct and specific conversation with your primary care physician about your hantavirus risk profile. Before you clean, before you go near any rodent-prone space, and before the summer rodent season peaks. I know this may not be what you were expecting at number 1, but here is precisely why it holds this position. A 2022 survey conducted by the American Geriatric Society found that fewer than 8% of adults over 65 had ever discussed zoonotic disease risk, which simply means diseases that can be transmitted from animals to humans, with their primary care provider. Fewer than 8%. And yet your physician can do something for you that no amount of bleach solution or N95 respirators can accomplish. They can assess your individual immune status right now. They can review whether any of your current medications, such as antihistamines, corticosteroids, or certain blood pressure medications, may be suppressing your immune response in ways that make you even more vulnerable to this virus than the average person your age. They can note your specific risk factors on your medical record, so that if you arrive in an emergency department with respiratory symptoms, the connection is made immediately by whoever is treating you, and they can flag you for priority testing and rapid transfer to a specialist facility if you do become ill. There is no vaccine for hantavirus. There is no antiviral medication you can take in advance to prevent infection. But your physician, properly informed about your specific situation, can serve as your early warning system, your advocate, and your most important first line of defense if you do get sick. Print out the key points from this video. Take them to your next appointment. Say these words: I want to discuss hantavirus risk. I live in or regularly visit areas with potential rodent exposure. What do I need to know? And what do you need to know about me in case I become unwell? That conversation for a 68-year-old woman in rural Colorado or a 74-year-old man who spends summers in a lakeside cabin could be the conversation that saves her life or his life. And combine that physician conversation with the rodent audit from number 5 so that you walk into that appointment with specific, concrete information about your actual current exposure risk. A prepared patient receives a meaningfully more thorough and targeted clinical response than one arriving without context. Here is what I want you to carry with you from everything we have discussed today. You are not helpless. You are not at the mercy of this virus. You are an informed adult who now holds specific, actionable knowledge that the vast majority of people your age do not have. You know what hantavirus is and where it lives. You know how it enters the body and how quickly it can escalate once it does. You know what real documented cases have looked like in real people. And you know the 5 steps you can take this week, specifically and deliberately, to reduce your risk and your family's risk. Conduct the rodent audit. Acquire the N95 respirator and the nitrile gloves. Learn and use the wet cleaning protocol. Memorize the symptoms that demand immediate emergency action, and have that conversation with your physician. These are not complicated steps. They are not expensive steps, but they are the steps that separate people who are protected from people who are not. Your independence matters. The ability to open your own cabin at the start of spring, to clear out your own garage on a Saturday morning, to putter in your garden shed on a quiet afternoon. These things are not trivial. They are the texture of a full and active life in your 60s, 70s, and 80s. And it is absolutely not too late to protect that life. It does not matter if you have been cleaning spaces without protection for years. It does not matter if you have never thought about rodent-borne illness before today. Starting now, this week, with exactly what you know right now, you can change what happens next. Your longevity is not only about what you eat or how much you exercise. It is also about knowing which invisible threats to take seriously and acting on that knowledge before those threats act on you. Today, hantavirus moves from something you did not know about to something you understand and can protect yourself against. That shift matters more than you might realize. If you found this video genuinely valuable, please subscribe to this channel right now by clicking the subscribe button below. Every single week, I bring you information like this, specifically researched and designed for adults over 60. Information that your busy doctor may not have the appointment time to walk you through in detail. Share this video today with one person: a spouse, a sibling, a neighbor, a friend with a summer cabin. You may not know it in the moment, but that single share could be the most important thing you do today. And now I want to hear from you in the comments below. Have you ever cleaned a space that had rodent droppings without wearing any protection? And what is the one thing from today that surprised you the most? Tell me in the comments. I read every single one, and what you share consistently shapes exactly what I cover next for this community. I am Dr. Benita Fieldhouse. Take good care of yourself. You have carried this body for a long time. Make sure it is protected.